Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Okay. So I welcome everybody in this live class, and now we are starting with case discussions. I'm extremely happy that we have a lot of volunteers up for the cases to come. I'm deciding the case, and there comes a volunteer. I'm very happy with this proactive attitude of my students. I took up almost 2 cases in the first week, and the moment I announced it, I got the volunteers. So now the upcoming week, I'm planning to take up hypertensive disorders, which has already been taken, and the next slot, let's take up prolapse, because this is a case very often asked by a lot of in many institutes. All the students who've been through the practical have given me this feedback, and maybe the next week we'll take up the previous cesarean VBAC and previous cesarean in the next pregnancy being the a VBAC trial, or just a pregnancy with a past history of a cesarean section. So tonight we have anemia and pregnancy. I have my volunteer right there ready with the slides. Let's start with the case presentation, as most of my students have joined in. I want everybody, again, my very humble request, everybody to be active in the chat room. If you do not know how to join the chat room, just go on to the main channel from where you have joined in. There is a message which has been pinned. Okay, Jitu, there in the class, can you just put this message again in the chat box? Just click on that message and you can enter my chat room. So it's very, very simple. Okay. I think we should start the class.
Good evening, everyone. Today I'll be presenting a case on anemia in pregnancy. Before I start, I would like to thank Erum ma'am for her wonderful mentorship.
Thank you so much. This is a very good introduction. Let me, congratulate my student at the very outset. Very confident. I like your style. Yes, you can continue with it.
My patient, 24 years Hindu female, married since 3 years, resident of Nalasopara, educated till standard 7, belonging to lower socio-economic status, homemaker by occupation.
Okay.
She is gravid.
I'll just stop you here, beta. Like I have, as you can all see, this is the way I have mentored her. I have told her where all she can be paused and questions can be asked. So when you are explaining a case of anemia in pregnancy, nobody knows. I'm sitting here as an examiner and I'm just listening to your history. Okay. I know that you have got a case of anemia in pregnancy, and now I have started coaching you from here as to where all you can be stopped. Right. So when you start, and a very important thing, when you're presenting a history at a postgraduate level, usually not a lot of focus is given to your just history alone. A lot of focus is given on your management of the patient, right? Like I always say, there's a difference between the viva of an undergraduate and postgraduate. But here, I'm just going to point out the important points which even at a postgraduate level you can be asked. So here I'll just stop you and say that you are coming up with a case of anemia and pregnancy. Is socio-economic history of any importance in this case of yours?
Yes, ma'am. Socioeconomic status of a patient is very relevant in a case of anemia because it gives an indirect indication towards the nutritional status of the patient, as well as the level of awareness regarding her ANC visits and the current pregnancy, what all medication she needs to take. It gives an indirect indication towards this, ma'am.
Yes, very important is a low socioeconomic status. That means most probably low, not educated well. She does not understand the importance of ANC visit. She doesn't understand the importance of taking medication on time, and maybe financially so downtrodden that they feel that why go and invest so much in medicine. We are all right. Last pregnancy also we did not take and we were just fine. So on and so forth. Okay, so the level of awareness, the level of seriousness is not usually met with, and you can have a lot of defaulters in this case, which is one of the prime reasons of your iron deficiency anemia and pregnancy. Please go on.
She is gravida 3, parent 2, living 2, with previous to full-term vaginal delivery, with history of 8 months of amenorrhea, registered with irregular ANC visit, came with complaints of fatigue and generalized weakness, progressively worsening over last 5 to 6 weeks.
That is her presenting complaint, beta?
Yes, ma'am.
That's the only complaint she came with?
Yeah, ma'am.
Okay, so what are the usual causes of generalized weakness and fatigability in pregnancy?
Pregnancy as such, in many patients, pregnancy as such results in fatigability and generalized weakness. Other than that, there might be any pathological cause to it, like in cases of anemia, cardiac, any cardiac underlying cardiac disease in the patient, or conditions like hypothyroidism may
Yes,
lead
yes.
to easy fatigability and generalized weakness.
All right. All the students in my class, do you have any other DD for easy fatigability and generalized weakness in pregnancy? You're free to keep writing down, okay? Any DD that you feel apart from the ones we discussed. So very common. You have to mention very common things. Usually in a patient with cardiac disease, what symptom do you find as the most important apart from this easy fatigability?
Ma'am, dyspnea on exertion, or yes, ma'am.
Yes, absolutely. So you basically, with the patient who comes with a cardiac disease in pregnancy, she will also complain of dyspnea on exertion, palpitation, as we call shortness of breath, as Bratish has written. Absolutely right. So mostly that is the first symptom of a patient with cardiac disease. And easy fatigability, they confuse it with this only. That I get too tired too often. So maybe the heart is not compensating with the increased load of pregnancy, the hemodynamic regulation of pregnancy and the increased demands of pregnancy, then the heart is not able to compensate. So she will come with easy fatigability, generalized weakness, and most importantly, dyspnea on exertion. So here I'll ask you regarding the different classes of dyspnea on exertion according to NYHA classification.
According to NYHA, there are four classes of dyspnea on exertion. Class 1, there is no dyspnea on ordinary physical activity. Class 2, there is slight limitation of ordinary physical activity. In class 3, there is marked limitation in less than ordinary physical activity, but the patient is absolutely fine when she takes rest. In class 4, there is severe limitation there is severe limitation of less than ordinary physical activity. Mostly these patients are bed bound.
Yes. So, you know how the examiner wants to hear it? They don't understand slight and they don't understand moderate and marked limitation. They don't understand. They want to understand in how much physical exertion will they start having breathlessness. So, we usually mark it like breathlessness on rest is class 4. It's very severe. And breathlessness on less than ordinary activity is what we call class 3. And with ordinary activity, and she's having breathlessness, that's class 2, and no breathlessness is, or on very severe exertion if she's having that is probably class 1, right? So when you say no symptoms, it's okay, that is understandable, but when you say slight limitation, they want to hear what exactly do you mean by that. It's very subjective. So what I'm trying to show by this is that she has just spoken 2 sentences up till now. Okay, she just told me with the presenting complaint the patient came to you. Why did I stop here right now? The same thing you will see when I take up the gynae case. When she's telling me the presenting symptoms, I'm stopping her and understanding what is she thinking right now, what all DD is coming into her mind just by the presenting symptoms, because from here her history is going to diversify. She is going to take the history accordingly as her mind is going planning the DD. For example, she just said that complain of easy fatigability and generalized weakness. So she said I made a DD of most important 3 things. Either it is just physiological, maybe she's overburdened at home. Okay, she's doing a lot of work and that is why she's having a lot of tiredness, which is very physiological. Specifically, she came to at 8 months of amenorrhea, right? So you know that towards the end it's more and more of easy fatigability even for a normal person. So maybe it's physiological, maybe she's having anemia, maybe she's having an underlying cardiac disease, because as you can see she's pretty non-compliant, and maybe she's having hypothyroidism. So from here we are going to ask questions directed to these 4 DDs which have come into our mind. Okay, so my negative history is going to depend on these 4 mostly. This is what I want to impress upon you. All right,